everyone. My name's Jo and I'm a nurse. I've had a really busy year this year, as I suspect have all doctors, nurses and other key workers, all down to the coronavirus pandemic, which I'm sure you'll have heard lots about. Now I'm working at home today and I'm talking to people over the computer. So you may have done this year yourself. You might have seen a doctor or a nurse over a computer rather than going to the surgery face to face, because like everyone else, where possible, we're avoiding too much contact with other people to try and help with the spread of coronavirus. So as I'm here by my Christmas tree, I thought I would have a chat with you all and try and answer some of the common questions around coronavirus and give you a little bit more information as we lead up to Christmas. So I've written my questions down to make sure I don't forget them. Firstly, what is coronavirus? Well, you might have heard it called COVID-19, which is the other name for it. It means the same thing. And it's a really highly infectious disease that is spread all around the world from person to person, affecting thousands and thousands of people. And that's why we call it a global pandemic, because that's what pandemic means. It means it's affected lots of people in a big space and can't get much bigger than all around the world. So, question 2, will you know you have it? Not an easy answer, that one, because some people do have coronavirus, carry coronavirus, and don't know they have it. That's why we have to be really careful generally with everybody all of the time and assume that any one of us could be carrying it. Now, if you do get it, you might be quite poorly with it, but in truth, most people aren't that poorly. People will have symptoms, and the most common symptoms are a dry cough, a high temperature, and losing your sense of taste and smell. Not everybody gets those symptoms, and in fact, for some people, it might be just not feeling quite right, feeling not yourself. Tummy bug is another one that's quite common people present with. So if you get any symptoms, you feel different, you feel not like you normally do, then it's really important to tell somebody so that you can be checked out to make sure that you don't have coronavirus. Now, as I say, for most of us, we'll be okay if we get it, but for some people, it can be really serious. Generally, that's people who are older or people that have long-term health problems. And you could have long-term health problems yourself. So it's really important that you're protected and that you protect those around you against coronavirus. So that brings me to my next question of how is it spread? Well, from what we know about it, it's spread through the air in droplets. So if we were to cough, sneeze, or even talk, droplets can be carried from our mouth and nose through the air, and they can find their way into somebody else. If we've got coronavirus, those droplets go through the air into someone else, they'll also get coronavirus. And again, they might be really poorly from it, less poorly from it. Better they don't get it at all. So, how do we stay safe and stop the spread? Well, you've probably seen lots on the television about this, and there are 3 key messages: hands, face, space. So what does that mean? Well, hands. So I've said that it can be carried through the air in droplets, but if we were to touch our face, if we were to touch something that's been coughed on or sneezed on, and then touch something else, we can spread the coronavirus around through our touch. So it's really important that our hands are clean at all times. So very, very regularly. So you would normally wash your hands when you've been to the toilet, if you've blown your nose, before you have something to eat or drink, hopefully. But it's even more important that we wash our hands very regularly now, before we touch anything, after we touch anything, just in case coronavirus is present. Best thing to do is to wash our hands thoroughly with soap and water at the sink. But of course, we haven't always got a sink on standby. And for that reason, we have our alcohol gels and sprays, and I'm sure you've used these already. I've got a nice little one that I carry around in my pocket or my bag all the time, and a couple of squirts of that on your hand, rubbing it in all over the surfaces of your hand and your nails and your wrists. Make sure you've covered absolutely everything so your hands are sanitized and not able to carry that coronavirus bug around. So that's hands. Face means cover your face. So many of you will be used to wearing masks by now, I'm sure. And by wearing a mask, now I've got one here. Mine is quite a boring clinical surgical mask that we wear in a clinical area. You've probably got a lot cooler one. I just bought my niece and nephew masks with sharks on, which are a lot more fun than these. But it's really important that we wear a mask when we're out in public or when we're around other people, and that they do too. Because if we're wearing a mask, then if we do cough, sneeze or talk and any droplets come out of our mouth or nose, they're going to be caught in the mask rather than traveling through the air to other people. And if other people are wearing masks, then if they do the same, they cough, sneeze, talk, the droplets that are coming from them aren't going to make their way through the air to us. So all of us wearing masks is a really, really important thing to do. Now, I know they can be uncomfortable. They can make you feel a bit short of puff. They can rub behind your ears. Certainly they fog up your glasses if you wear them, but it's really worth it if you can, because we know that masks help keep us safe. So that's hands and that's face. The last one of the three is space, and space means just keeping our distance from people. So it's recommended that we keep at least 2 meters away from people where possible, unless they are people that are in our bubble, and I'll talk about that in a minute. But certainly when we're talking to people, when we're out and about in public, it's really important that we keep that space around us. Sometimes there's little stickers on the floor, there's arrows telling us where to stand to keep us away from other people. So it's really important that we respect other people's space, but also that people respect ours. And that means that it's okay if you see someone coming in for a hug with you or coming to touch you, and actually you need them to keep the distance from you to keep you safe as well as them. So sometimes people might need a reminder to please watch my space, watch your space, to keep us all safe. And it's perfectly okay to do that, because we all forget things sometimes. So hands, face, space, really simple ones to remember. But I hear you ask, what about Christmas? We know it's the most wonderful time of the year, but we also know that there's a chance we're going to see more people than we ordinarily would because it's Christmas. So we have bubbles at the moment, and I don't mean bath bubbles or bubbles that you blow out in the garden. Bubble is our little grouping in our family unit, or if we live on our own, we may have formed a bubble with somebody else, where those are the people that we can see and be closer to, but we stick to our own bubble, and people don't come into our bubble and we don't go into other people's bubble. But over Christmas, it's possible that we may be able to see a few more people and form Christmas bubbles. Now, whilst it's going to be absolutely lovely to see other members of your family, other friends, and be able to celebrate Christmas after this really difficult year, it's also very important that we remember those messages still apply, because coronavirus doesn't know it's Christmas. And if it gets the opportunity of people all being together, then it's going to have its own Christmas party and start spreading amongst us. And what we really don't want for Christmas is coronavirus or to give it to somebody else. So it's so important that those 3 messages of hands, face and space are stuck to really carefully over Christmas. And even if you're allowed to see more people, then do hold off the kisses and hugs, because much as we might want them, it's so important that we all stay safe. So, final question, will it go away? Well, you may have heard on the news that we've got the most incredible Christmas present that we could have asked for. And that is that there has been a vaccine made for coronavirus. So each and every one of us will be, over the next few months, offered the vaccination to protect us against coronavirus. So this is going to be in the form of an injection into the top of our arm, and we'll be having one injection followed by another injection several days later. And then once we've had both of the injections, we have to wait over the course of a few weeks for our immunity to build up to the coronavirus. Now that just means that our body starts to build up its own system of protecting ourselves against the virus. So the virus will still be out there, but we'll be protected from it. So you might be getting your vaccination very soon. Some of you might even have already had it, but it's important to wait and give it time and stick to the rules of hands, face and space until we have a period of time that's gone past when we can be more confident that we're protected from coronavirus. So we're not going to get it ourselves and we're not going to pass it on to other people. Because let's face it, by next Christmas, what we want is to be surrounded by all of our family and friends, being able to hug, being able to kiss, being able to sing Christmas carols, sit round the table together and do all of the things that we normally all love to do at Christmas. And the only way to make sure we can do that is by being as safe as we possibly can this year. And I know that's not easy, but I know you can do it because we have to. So on that note, I'm going to go now. I'm going to get back to work and start talking to my patients. And I wish you all the happiest and the safest Christmas. And I'm looking forward to the happiest new year when we can all be together without coronavirus. Take care then. Bye.